about vaccines in Taiwan, and I am here with the Division Director of Acute Infectious Diseases at Taiwan Center for Disease Control, Ms. Yang Chin-Hui. Thank you so much for joining us today.
Thank you. Good morning.
Good morning, and we're very interested in the vaccine plan for Taiwan. Can you tell us how vaccines are going to be rolled out, how the government plans to vaccinate the population here?
Our goal for 65%, I think at least we need 1 year almost to complete. This is
Really?
the best estimation, yes. Most vaccine will come in the next half years, from July to December. So during that time, I think we will mass vaccination program during that time. But in the beginning few months, we will arrange our vaccination program according to the vaccine we have.
So there's going to be a priority of who can get the vaccine first, right?
Yes, initially we will get the healthcare worker as the top priority because they get the big risk to care for the suspected and confirmed COVID-19 cases. The second priority will be the quarantine and the public health, like these essential workers. And then we are going to others essential workers like the police officer and the military and the long-term care facility. We also add one risk is who if they have to go abroad because maybe due to business, like our Olympic athletes, they would be the third category because they would have higher risk to go abroad. Maybe offer some self-pay vaccines to people who need to go abroad. But this priority will be lower. Maybe after our essential workers, at least they complete their vaccination, then we will have some vaccine to get into the free market that people to get. And after the essential workers, the next priority will be the who are vulnerable to this disease. First is the elderly, those above 65 years old. Then is the from 16 years to 64 years, but they with a comorbidity. And then we will open to all people above 16 years old.
When do you expect the average citizen to be able to get vaccinated?
It's a difficult question. We hope we can do it very quickly, but as you know that this vaccine is totally different from the previous flu vaccine. In the flu season, we can do 6 million doses within 3 months, but it's only one shot for flu. This need 2 shots. We hope we can do it at least 50% by the end of the year.
So can you tell me how effective do you think the vaccine will be in preventing someone from getting COVID-19?
The BNT vaccine or Moderna vaccine, they can have over 90% effective to prevent to get disease. And the AstraZeneca at least for 70 to 80% to prevent the disease. But this is to prevent a symptomatic disease. If we want to prevent a severe disease, all these 3 vaccines have over 90% effective. So if you got vaccinated, you can prevent to get severe disease. So at present, evidence for prevent severe disease is very strong.
That's good to know. But I'm also curious, if someone is vaccinated, are they unable to carry the virus? Can they still be contagious to other people?
Yes, it's possible. So even you are vaccinated, we still need the non-pharmaceutical intervention like social distancing, wear mask to help yourself and protect others for this disease.
So once we start vaccinating the population, how is that going to affect our travel ban and people traveling to other countries? Like, for example, first let me ask you, if you got vaccinated, would you feel comfortable going on a plane to another country? You feel safe?
Not yet.
Not
If
yet.
all the world got vaccinated over 60% or 70%, which means the incidence in the world is lower, then it will be easier or getting comfortable to come out. The WHO still recommend, even after with the vaccination, we cannot just lifting the travel ban or lifting all the social distancing, this quarantine, this procedure, because the incidence now over the world still high. Daily we have 10,000 cases increase over the world. And at present, we still not confirm the vaccination lasts for how long. So before we can clear understand and all the incidents in the world is lower, I think we still have to wear mask and social distancing. But the vaccination is individual protection. If you want to protect yourself, you can wear mask, you can keep social distancing, and you can have vaccine.
So Taiwan will still require people to get tested for COVID-19 and be quarantined, even if they've been vaccinated?
At present, yes.
Like to come
Even
into Taiwan?
yes, until we have more evidence to support that the vaccinated people will not will not transmit disease to others, we will continue present procedure as WHO's recommendation.
When do you think that the world is going to return to normal? Or will it ever return to normal with this pandemic?
As my opinion, I think maybe 1 or 2 years after most people, we have more data from the study of the vaccination, and we have more data about the virus and the variants. 1 or 2 years, I think we can have more clear evidence for all this, and then we would have a way to prevent this disease and then back to normal. So actually, I think 1 to 2 years, maybe next year we can come back to normal life.
Really? Can I ask you a question about politics? How much do you think that politics, relations with China, will affect vaccines in Taiwan or affect, Taiwan's relations with the world? Vaccines and politics. Do you have any thoughts about that?
Politics is a difficult question, but it's true. Because we are not a member state of WHO and we cannot attend the WHO's meeting or conversation, so it it would have some difficult for us to get some information.
Hmm. But Taiwan has done very well despite our political challenges.
Yeah, we try our best.
And can you give us any last words about vaccines? Any advice for the general public?
Uh, I think vaccine is the best way to protect yourself from this disease. As we know, now the available vaccine can prevent the severe disease and can prevent and that the disease incidence seems to going down if you get vaccinated. So if the vaccine available to everybody, especially if you can, the vaccine is available to you, please vaccinate the vaccine and then keep wear mask, clean hands, and keep social distancing and wait the end of the epidemic.
Well, thank you very much, Ms. Yang Chin-Hui. She's the Division Director of Acute Infectious Diseases at the Taiwan Centers for Disease Control. Thanks so much for speaking with me.
Thank you.